Thank you for joining us for a holistic approach to decreasing stress. Before we get started, I wanted to share a statistic with all of you that highlights why decreasing our stress is so important. Did you know that 75 to 90% of visits to primary care providers are stress related? The truth is, we all experience stress. According to a recent survey by the Harris Poll, on behalf of the American Psychological Association, shows you are not alone. More than 80% of those surveyed are facing current stressors like inflation, supply chain issues, global uncertainty. Add these to daily concerns about health, employment, family, children, finances, and society's increase in violence. It may seem like you can't catch a break. This is why today's presentation is so important, and it's also to teach you how you can catch a break. You will learn about what is stress, how it affects your mind and body, what causes you stress, and better yet, how to take a break and calm your stress response. I wonder if you're feeling stressed. In fact, you may not even realize it if you're stressed. A few quick body checks can help you tell. Are you breathing shallowly? Put one hand on your chest and the other on your belly. When you breathe in and out, pay attention to which hand is moving. Calming breaths draw air deep into your lungs so that both your chest and belly expand. Shallow, tense breaths involve only your chest. Are your neck and shoulders tense? Take a deep breath. As you breathe out, slowly roll your shoulders up and towards your ears, then back and down, relaxing them as much as possible. Are your shoulders lower than they were a moment ago? Are you clenching your jaw or your fists? Take a deep breath, then relax your jaw until your lips are slightly parted. Take another deep breath and relax your hands so that your fingers are loosely parted. Now that you completed a quick body check, let's look at the definition of stress. Stress is a natural, even necessary part of life. Stress is not an indicator of something that's wrong with you. In fact, stress can be an opportunity to become skilled at calming your stress response and taking a break. Stephen Palmer and Frank Ferencek, internationally recognized experts in the field of health and stress, agree stress is all about perception. The perception that demands placed on you are greater than your ability to meet those demands. In other words, what you can change is your perception or how you view situations, how you relate to your stressors. Next, let's look at the type of stress. When talking about stress, it's important to differentiate between acute and chronic stress. Acute is short-term, such as preparing a big project for work, a spam phone call, prospect of painful surgery, or someone cutting you off in traffic. Do you have an example from last week? I'm sure everyone has examples from daily stressors. Even the little things will stress us out at times. Chronic stress is a threat or event you experience that is ongoing, something like providing care for an ailing and aging parent, caring for a child with a disability, advocating for the vulnerable, or ongoing conflicts with loved ones. Chronic stress causes the stress response to go into overdrive. This ongoing stress is associated with diseases like high blood pressure, heart disease, and even stroke. Try to think of it like this. If I hold a glass of water for 30 seconds, nothing happens. How does your arm feel? Feels great. Nothing happened. It's a glass of water. Everybody can hold a glass of water for 30 seconds. Now, if I told you to hold that same glass of water for an hour, how do you think your arm would feel? It would probably begin to ache a little bit. This is what allostatic overload means. When you start to feel the effects of these little things kind of building up over time. And then if I ask you to hold it for a day, how do you think your arm would feel? Probably numb and paralyzed. Having even more of an allostatic overload will occur. So how heavy is this glass of water? Truthfully, the weight of the water and the weight of the glass doesn't matter. It depends how long you hold on to it. The weight of the glass hasn't changed, but the longer it is held, the heavier it gets. The stresses and worries of life are like this glass of water. You can manage them for a little while, and there's no problem. Manage them a little longer, and your mind and body begin to hurt. Manage them for days and weeks and months, and some for years. You may feel paralyzed, incapable of doing anything if there's no break. But what happens if you put the glass down? You calm their stress response by taking a break. That's what today's presentation is all about, how to give your mind and body a break from your stress response. Did you know there's also good effects of the stress response, not just bad effects? Stressors provide you the opportunity to rise to the occasion, to act decisively and heroically. You can become focused and gain a sense of control, problem solve, adapt, and strengthen relationships. In other words, you have the resources needed to meet the demands. This positive effect is seen with first responders who act to help others in dangerous, life-threatening situations. Now, we all know there's a time when we recognize stress as hurting more than helping. Examples of this include insomnia, depression, affected relationships, and chronic pain. Let's look at the effects of stress on the body and the mind, physically, mentally, and emotionally, as well as behaviorally. The stress response can be perceived just about anywhere in your body and mind. The stress response begins in your brain, then travels to your body through hormones and activates the autonomic nervous system called the sympathetic nervous system. That's why you feel your heart beat faster, your palms get sweaty, your breathing quickens, muscles tighten, you clench your jaw, your blood pressure starts to go up, and your digestion slows. Some of the signs caused by the release of chemicals in the body are listed on this slide. However, keep in mind that stress presents itself differently in different people. As we review these signs, think about which ones you experience. Perhaps the shoulders feel tight, or someone feels more tired than usual. They may even experience trouble sleeping. Many individuals complain of headaches when they experience stress. Other signs are stomachache, indigestion, restlessness, constipation or diarrhea, and palpitations. Some people might experience mental signs of stress, including feeling flighty and anxious, sad or hopeless. Someone may have difficulty concentrating or listening to others. Other signs are frequent crying, feeling powerless, or a quick temper. Some others experience emotional eating and overeating, fist clenching, being overly critical of yourself and others, grinding of your teeth, changes in the amount of alcohol consumed, desire to withdraw from others, rumination or frequent talking and brooding about stressful situation. You may know someone who, like many others, increased their alcohol consumption during the height of the pandemic with all that increased stress. Now that you understand what stress is and how it affects your mind and body, let's talk about the key piece of today's presentation, calming your stress response or taking a break. Think back to the cup of water from earlier, and remember, it helps to put it down and take a break. Think about a time when you were stressed. What were you thinking? What were you feeling? And how were you acting? The first step in calming the stress response starts with understanding what is going on in your head and why. This is known as self-awareness and involves simply asking yourself questions like the ones listed on the slide. Are your thoughts chaotic? Are all of them running around endlessly in your head and getting you nowhere? Do you feel overwhelmed and overburdened? Do you find it difficult to concentrate at work and to pay attention when your significant other or children are speaking to you? Let's look at the second step, understanding triggers and recognizing if your response to them is helping or hurting. What is provoking the stress response, setting off your sympathetic nervous system and affecting your mind and body? In other words, what's bugging you? Are you concerned about finances, political unrest, your health, and the health of your family and friends? Have life changes disrupted your day-to-day routines? Have you had to decrease physical activity, or are you drinking more alcohol or using tobacco products? Speaking of tobacco and alcohol, they are often turned to when someone feels stressed. But did you know, oftentimes they actually increase your stress response instead of decreasing it? Next question, is your response to the stress helping you to stretch and grow? If it is, the right amount of stress, it is possible to meet the demands and positively impact your health. However, too much stress for too long without a break can prevent you from taking care of yourself, being there for others, or being so paralyzed you can no longer problem solve. Again, think back to the glass of water and reflect on your current stress response. You may have your ways of dealing with stress. Some may be healthy, like calling a friend, going for a run, or getting enough sleep. Others may be unhealthy. Some unhealthy ways of relieving the pressure are endless hours of TV, overeating, undereating, excessive use of alcohol, taking illegal drugs or unsafe drugs, or withdrawing and sleeping too much. These unhealthy ways often provide immediate relief, but over time wear down your body and mind, increasing the risk for a lowered immune system, anxiety and depression, and overall can increase your stress response. Next, let's look at evidence-based and healthy ways to give yourself a break and calm your stress response. The strategies listed on the slide help the body and therefore help the mind. In fact, study after study noted by Harvard Health in their stress management paper showed healthy response to stress can positively impact health by affecting heart disease, blood pressure, irritable bowel syndrome, and anxiety and depression, as well as making life more pleasant for people with diabetes. We know you're fully aware of the importance of hydration, nutrition, exercise, and sleep in protecting your health. However, do you know why these healthy lifestyle practices play a role in managing stress? Think of a day when you did not hydrate or eat a healthy meal. How did you feel? Now compare that to a day when you hydrated and enjoyed a healthy meal. How did you feel that day? You probably felt much better on the day you were hydrated and eating a well-balanced and healthy meal. When you fuel your body with the right balance of essential nutrients and keep it hydrated with plenty of water, your body works more efficiently, thus decreasing the stress on your body. Exercise causes endorphins, or feel-good messengers, to flood your brain. It helps improve your memory, thinking, resilience, and mood. The American College of Sports Medicine shares the evidence that when you exercise regularly, you can experience a reduction in your stress response. That's a welcome side effect. We are all well aware that a good night's sleep is vital to combat mental and physical tiredness caused by stress. Well, think of the worst night's sleep you ever had. I doubt you were feeling energetic and happy the next day. In fact, I wonder if you found your memory and thinking were not clear. You were irritable, less flexible, and less able to take things in stride. In contrast, consider how good a good night's sleep helps you feel. You feel energetic, clear-minded, in control of your emotions, and enjoy a sharper memory. All really great results that help you confidently and consistently calm your stress response. The strategies listed on this slide enhance the mind's interaction with the body to calm the stress response. Dr. Benson of Harvard Medical School states that anything that breaks the train of everyday thought calms the stress response. That includes mind-body exercises like deep breathing, mindfulness, meditation, Tai Chi, and yoga, as well as participating in repetitive sports such as running. Letting go of tension through progressive muscular relaxation, knitting, crocheting, even playing musical instruments. In addition, people of varying faiths may have a phrase they like to repeat as they pray. Another coping strategy that can help manage stress is redirecting or changing your perceptions. This is the classic, is the glass half empty or half full? Changing your mindset doesn't mean taking a Pollyanna view of the world. The key isn't to deny stress, but to be honest about it and then decide what, if anything, you can do to change it. Gratitude also calms the stress response. Who is someone you're grateful for? Write down their name and why you're grateful for them. Maybe you could contact them and tell them this. This will ease their stress response and it'll also ease yours. As a human being, you're a social creature. Your supportive relationships through others and your community are one of the most accessible, effective strategies to calm the stress response. Don't hesitate to speak with a trusted friend or family member. Not a single person, man or woman, with whom I've ever worked has regretted connecting with a mental health professional during the challenging times. Please don't suffer alone. These professionals have tools that will help you to gain strength faster than you could get on your own. Now let's look at other practical resources and tools available to identify your stress level and calm your stress response. I invite you to take a moment to complete this quick stress test. So what you'll do is you'll read the 10 line items, and for each one you'll rate 10 being the worst or 1 being the best. At the end of that, you'll add up your score, and if you scored more than 50, it's time to calm your stress response. So how is your stress level? Is it more than 50, almost 50, less than 50? Next, think about what are your stressors? How is your response hurting you or helping you? Imagine with me if your response to stress was helping you, not hurting you, making you stronger and able to problem solve, and enjoy your family and friends. What would be different in your life? Let's look at how you can set yourself up for success. How do you go about designing a plan to calm your stress response? Just like the slide indicates, you need to be smart. To set yourself up to effectively calm down your stress response, your goal should be specific, measurable, attainable, relevant, and timely. As I'm going through this information, I'd like you to take a moment and develop your personal SMART goal. How can you align your goal so it's specific? What unit will you measure? How is your goal realistic and attainable for you? Does your goal relate to how much you want to calm your stress response? Within what time frame would you like to achieve your goal? Your initial goal may look something like this. I will calm my stress response. It's vague. It doesn't really give you a plan or any kind of guidelines on how you're going to measure that. Instead, you should try something more like this. I will have dinner with family 3 nights a week for a month. I will delegate household chores and ask the middle child to take out the garbage for 1 month. I will take a 15-minute walk with my wife and dog 3 times a week for a month. What is your SMART goal? Know that stress is a common human experience, and there are resources, tools, and strategies designed to help you calm your stress response and enjoy a stress break. If you or someone you know is suffering from overwhelming stress, there are resources to help. There's employee assistance programs, your primary care physician, the crisis text line. There's also the Psychology Today website to identify mental health therapists in your area. And then crisis helplines. There's the National Suicide Prevention Lifeline, and then there's the Treatment Referral and Information Line. There's also apps. So you can go for more app information. You can go to stress.org and search their mental health apps. Some people tend to function better using an app. Others like more that in-person, face-to-face kind of work if they are trying to get their stress and mental health under control. The Holmes-Rahe Stress Assessment Inventory is a well-known tool for measuring the amount of stress you've experienced recently. Taking the test can help you see if you're at risk for illness due to the combined stresses you face.